If patient has this any of these 7 warnings, we can suspect that patient has cancer. So in that, change in bowel or bladder habit. See, there are some patients who are continuously having diarrhea and continuously having constipation. Diarrhea, constipation, actually they don't have fever or abdominal pain, anything, but still they will be having this type of symptoms. So in that, if patient has no infection or no other cause, in that cases we can suspect that patient may have cancer. Okay, GI related cancer. And this is very important. Dhyan, everybody should focus here. Some patient will be having sore throat. एंटीबायोटिक लो, अजिथ्रोमाइसिन लो, अमॉक्सिसिलिन लो, कितना भी लो, खांसी आती रहती है and sore throat is continuously seen in the patient. If a patient is having continuous sore throat, they have risk of causing cancer. ऐसा नहीं है कि ये है तो कैंसर है, बट इफ these symptoms are there, they has risk of causing cancer. So this is just screening test. ये सब screening है बस. And if patient has unusual bleeding and discharge, especially for females, this is also one sign of cancer. And thickening or lump formation in the breast or in some other tissues, like in males in testis, if lump formation is seen, or in other soft tissues lump formation is seen, in that cases we can suspect. And indigestion or difficulty in swallowing. थोड़े पेशेंट्स है, it is they can't swallow properly, तो माउथ कैंसर हो सकता है. People will be having chewing abilities like supari and all pan masalas continuously, they will be using that. Smoking patients also, in those patients, if they have difficulty in swallowing, so we can suspect pharyngeal or oral cancers. Okay. And change in wart or mole, this is important. See, if chotepan se from the start, from the childhood, some people will have small warts on their finger or on their skin, somewhere on the tissue. Or moles are very common. Moles are also very common on the tissues on the skin. If the wart and moles are suddenly changed, their morphology is changed, their color is changed, or their size is changed, in that cases also we can take as sign for cancer. Okay. And nagging cough or hoarseness. So see, some people will be having nagging cough. Nagging cough means it is a type of cough actually. थोड़े patients में woof woof करके cough आता है, that is called woofing cough. Nagging cough is also very similar to that, but continuously patient will be coughing. एक single cough नहीं आता है, continuous frequency आता है, that is nagging cough. And hoarseness, cough sound will be little bit different, and voice is also different in those conditions. If that is suddenly seen and if it is persisting to the patient, we can uh, have a sign of cancer. And if patient has warning, I mean, if these signs are there, we can see the physician. And see, these signs are for everybody. These are for everybody, for adults and everyone. For particularly for small children. For children, if sudden weight loss is seen, that is one sign for cancer. And the patient has headache and vomiting, particularly in the mornings. छोटे बच्चे में morning में headache और vomiting नहीं आना है. If this is continuously seen, that is sign for cancer in children. Increased swelling or persistent pain in bones and joints. छोटे बच्चे में bone pain, joint pain कहाँ आता है? It is very less. Its frequency is very less. If patient is having symptoms of swelling or pain in the bones and joints, we can suspect bone marrow related cancers. Leukemia में हो सकता है. Leukemia, okay. And lump or mass formation in the abdomen, neck, or elsewhere. This is seen for adults also. Development of whitish appearance on the pupil and recurrent fevers, uh, which is not cured due to which is not caused due to infections. Even in that cases also we can suspect. And excessive bruising and bleeding, noticeable paleness and prolonged tiredness. दूसरे conditions भी में भी होते हैं, but if these particular signs are seen continuously, even after taking normal treatments, then we can suspect that patient is having cancer. These are screening test. Okay. Okay, chalo. In today's class, let us try to learn few more basic points, and we'll start with the uh, pathophysiology, and then we will start treatment modalities, and we'll begin pharmacotherapy and pharmacology. Okay. So